Why is finding a rare disease diagnosis so hard? Imagine searching for a name for a puzzle piece that doesn't quite fit anywhere. That's what it feels like for many patients trying to find out what's wrong with them. Rare diseases are tricky because they are so uncommon. Less than 1 in 2,000 people might have the same condition, so doctors see them very rarely. This means many healthcare providers don't recognize the symptoms right away. Symptoms of rare diseases often look like common illnesses. For example, fatigue, muscle weakness, or stomach pain can be signs of many different conditions. When symptoms are so general, it takes longer to figure out what's really going on. Sometimes, patients see several doctors, each focusing on one part of their health. This can lead to fragmented care, delays, or even misdiagnoses. The process can take years, which is frustrating and exhausting for patients and their families. One big reason it's so hard to diagnose these diseases is that doctors don't see them often. Because they affect so few people, many healthcare providers have little experience or training in recognizing them. This lack of awareness means they might not think of a rare disease as the cause. Also, many rare diseases are genetic, so identifying them requires advanced genetic tests. These tests, like next-generation sequencing, can cost thousands of dollars and take weeks to get results. Not all clinics have access to these tests, especially in rural areas. Another challenge is that there isn't enough research or clinical data on many rare diseases. Without enough information, it's hard to develop clear diagnostic guidelines. This makes it even more difficult to confirm a diagnosis quickly. Because of limited data, some rare diseases are often misdiagnosed as more common conditions, which delays proper treatment. For patients looking into clinical trials and new treatments, getting an accurate diagnosis is very important. It opens the door to specialized therapies and the chance to participate in research studies. Advances in genetic testing are helping speed up diagnosis times, but interpreting complex genetic results can still be tricky. Sometimes, tests show variants of uncertain significance, which makes it hard to know if a genetic change is causing the disease. To improve diagnosis, teams of specialists working together can be very helpful. These multidisciplinary approaches combine different expertise to evaluate symptoms thoroughly. Connecting with rare disease research networks and patient registries can also help. These groups collect data that can lead to better understanding and faster diagnosis in the future. In the end, finding a diagnosis for a rare disease is tough because these conditions are rare, symptoms are often confusing, and there's limited awareness and data. But with ongoing research, better genetic tools, and collaborative care, we are moving closer to making diagnosis easier and quicker. For patients, staying persistent and seeking out specialized testing can be key steps toward finding answers and accessing new treatments.